Hello, NEET PG aspirants. My name is Dr. Dvitvora and I'm here to interview Dr. Akshay Yadav sir, who has currently pursued MD Anesthesia from LTMMC, Sion, Mumbai, and to clear all your doubts about one of the most revered branches, that is anesthesia. Welcome to the interview, sir. It's our pleasure to have you, sir, at Know Your Calling. So my first question to you, sir, can you give a brief idea about the branch anesthesia?
Yeah.
Aspirants are curious to know.
Yeah, definitely. So basically, what is anesthesia? Anesthetist is a pedi of physician. So
Right.
preoperatively, we have to optimize the patient. Then intraoperatively, we have to give the care so that the vitals of the patients are normal. And postoperatively, which is very important and which many UG students might not be doing, even we are having a role in post-op period till the patient becomes normal. This
Right.
is just the anesthesia part. Then there is pain medicine also linked with it, and you can start your own pain clinics after doing pain fellowships. And then definitely many of us go for critical care aspect, and where we can officially work as an intensivist.
Right. So it is quite a far-fetched branch which has many scopes.
Yeah,
Yeah,
definitely.
right. So, sir, let me initiate about the residency part. What is the life of an anesthetist resident? How do the students, how would they expect those 3 years?
Yeah, like there might be a misconception amongst the UG students. Definitely, when I was a undergraduate, at that time I just used to go with internship for the morning hours, and I thought, yeah, it is very easy. But then when I came to my postgraduate life, and when the calls started every 3 day, we used to work for 32 continuous hours. And in those hours, you cannot miss anything. You should be very alert. If you miss any small detail, and if you're not processing it correctly, you can lose the patient on table. So definitely it is hectic. But then yes, on holidays you get holidays, unlike other branches, especially other clinical branches. When even on holidays you have to go for ward rounds and all these things. So unless and until you are on emerge duty, definitely you can enjoy your life. But then when you are doing your residency, and when you are inside the OT or inside ICU, you should be very, very alert. And that is why it is very hectic, I would say. And the calls part, the emerge duty parts, everywhere, not just in Mumbai, other parts of Maharashtra, other cities also, it is very hectic.
Right. So even though the branch is hectic, you get enough time at least to, rejuvenate yourself.
Yes, definitely. Like I said, on holidays when you are not having your most you can give rest to your mind, because that rest is very important, especially in March. Like I said, you cannot make a small mistake. In fact, you have to correct mistakes made by surgeons also. I should not say this here, but then yes, when there is more blood loss, you should be alert enough to clinically judge that the patient needs blood, or any prompt thing which you have to do. You should be very alert. So that is
Right.
why rest is very necessary.
Right. So now this takes me to the question, what do you like about this branch per se, anesthesia?
Yeah,
What are the things you love about this branch?
So speaking on my own behalf, I don't know about my other colleagues, but I love the thrill which is there, because you don't know next second what will happen. Patient can land into, and personally experiences, a young fit male patient landed into cardiac arrest inside the OT, when even when the OT was not initiated. So you should be ready for that, and that thrill I love the most about my branch, and especially in the when I'm posted in ICU. So you can give instant relief to patients. May it be pain relief in the OT or in ICU if the vitals are not good, if the BP is rising. You can instantly give relief to the patient. That part I love.
Right. I think that is the most satisfying part. When we are the only people between patient's grave and his life. So, right. Any cons associated with the branch?
Yeah, definitely. As others know that it is a dependent branch, and then you should have good relationship with your surgeons and fellow colleagues in the surgical field. Not just in surgical field, like in gastromed people, when we go and give anesthesia for ERCPs, colonoscopies, and other things. So with everyone, you should have a good connection. Also, when you are practicing pain medicine, so people should refer to you, like if a condition is not getting treated by orthopedic surgery. So they should refer to you. So that is why. And secondly, you are behind the curtains every somewhere or the other. We are ourselves responsible for that, because when to declare that, you just say your fellow surgeon, then go and declare, or you don't yourself when you don't yourself establish rapport with the relatives and patients. So that is why you are behind the curtain. But ICU, that part is not there. But then, yes, who wants the credit might feel this as a con for this branch.
Right. So, guys, let me reiterate what he said. Networking is very important for this branch. You should have a proper rapport with all the doctors, surgeons, and each kind of surgeons. And keep this in mind that you will have to stay behind the curtains with this particular field. Right? And so, what type of personalities should reject anesthesia or accept anesthesia? I think many students have such kind of questions.
Yeah, see, as I said earlier, you should be very, very active. If you are lazy, if you are ignoring minute details, so definitely I think you cannot pursue the branch, because if every second is important when you're inside the. So if you're missing anything, you can definitely lose the patient, and which is very grave medical legal negligence, which can be there. And definitely part is there that you should have a good memory. Like you can see in my room, there are various charts behind. So you should remember various protocols, various doses, because see, like I'm just giving an example. Like if you're practicing in OPD, even if your dose is not adjusted, so the next visit you can adjust the dose. Here you are giving intravenous drugs, and even if you place 1-0 with anything, especially in pediatric patients, neonate patients, so you can lose the patient. So that is why alertness, activeness, and good memory, these three things are there required, which are required.
Right, sir. That was very well summarized. And what is the settlement time the students can expect with this branch, sir?
Yeah. So various interviews you might have saw that, like they say that patients should trust them, then only they will come. That the surgeon is good, so I can maybe believe that particular surgeon. In other fields also, but in our field, just after you pursue the branch MD anesthesia, like after my results, I can go and practice anywhere. So the earning starts very early, but it is not the slope is not like this, like for other branches. It is a very kind of stable slope when you earn the money. But yes, if you are doing the government job also freelancing together, you can earn a very decent amount. And especially in critical care, and pain is a very evolving thing. Like in abroad, out of India, if patients are having backache, they will directly go to anesthetist with before going to orthopedician. So that is why the essence of branch of anesthesia is very much in UK, US, and other parts of the world. But here, definitely, patients don't know much about it. So that is the problem.
Sir, you talked about freelancing as an anesthetist. Sir, can you briefly talk about it? Because many students generally do not have complete idea about it.
Yeah, so freelancing is basically when in the government setup, generally you have to go for OT in during morning hours, 9 to 4. And then surgeons also do that thing. They do their government job, and then they post patients in electively in the evening. So at that time, as I said, you should have a good rapport with them. More than the patients, you should have a good rapport with your surgeons and other fields. So that sometimes it happens that they wait for you. That even if you are not free, no, I want that particular anesthetist only for my patient, because I trust him or her. So they call you, and then you can practice. If you don't want, you can simply reject. So it's all upon you. We'll say that yes, it is dependent, but that is a good part also. You can reject your work, and if you're having some family issues, you can give time to your family, and you can initially only tell the surgeons. But yes, in emergencies, you should not reject. Would not recommend that. But then yes, when elective things are there, you can. And in this way, you can do freelancing. Also for pain medicine, you can start your own pain clinic. You might have saw. I've seen that pain clinics are there. So that is there. And in critical care field, you can open your own ICU, or you can join any private hospital, big hospitals for that.
Right. So, guys, what Sir said, make efforts in the initial phase, earn the trust of the doctors, and later on, when you have established your name, you can tweak your style according to your needs, right? Because you have already established the repo, so the doctors would be going for you. Okay. So, any difference between government or corporate setup or private setup as an anesthetist?
Yeah, definitely. In government setup, always vicarious responsibility is there. So when you are working after, even when you are professor, your head of the department is responsible for everything. But you should be, I mean, you should not dependent on others that even if I do mistake, it is okay. I'm not saying that. But then, yes, in government, you have a umbrella cover of, and you are safe from all the medical legal aspects.
Right.
So, but then in private, as I said, you should be very, very, very active and alert every second. So definitely, even if anything goes wrong, everything will come on. Even if a small spinal, if you have given and patient is suffering from post due to puncture headache, so patient will, and if patient feels, then he can complain about you. I mean, he cannot actually sue you if your mistake is not there. But then, yes, you are responsible for each and every action. So that is why, personally speaking, I would prefer government setup. And as everyone knows that yes, you can. I mean, electively stabilize the patients in government setup, because even the surgeons know that we are not having any personal interest in. So before taking the patient, you cannot. You won't take any risk. You will pre-op stabilize the patient, optimize the patient, and definitely the life will be better in government setup. But yes, you will be compromising on your earning part. That is the part. And in critical care aspect, I would say that there are no special emergency medicine departments in many of the colleges, or ICUs are not there in many colleges. So if you want to go in that part, pain clinics, pain OPDs are not there in many colleges. So if you are interested in that part, so definitely you should go for private hospitals. You should collaborate with them. You should join private hospitals.
Right. Okay. So basically, with private, you have to become more vigilant, but the scope is quite lucrative.
Yeah.
But with government, you have that umbrella cover, but again, the earning is not that limited, right?
But sorry to interrupt you, but then yes, even if a surgeon is there or any clinical field is there, sometimes they have to. I would not say work more, but then yes, in this when you are in government hospital and you are at a level of professor, assistant, associate professor, definitely the if you compare the work between both of them, so definitely your level of ease is more when you are an anesthetist and at professor level or associate professor level as compared to other clinical projects.
Right. Right. Okay. And big cities versus small cities, how does this affect from an anesthetist point of view?
Yeah, initially people used to say that in Mumbai you will get good options for freelancing, or in Delhi you will get good. But then when I was there in residency, I used to get, I mean, my seniors who were surgeons in India, surgeons, and even in the rural aspects of India, they were we were having demand there also. They used to say me that yeah, anesthetists are having good demand here. So everywhere, not just big cities, in even in small cities, the demand is very much for anesthetists.
Right.
But then yes, the pay scale differs according to the standard of living of that particular city. So that is one issue. But then demand is there.
Yeah. Sir, that was the exact point which I wanted to come back to. What are the monetary aspects associated? Now, having spoken about the cities and government private setups, kind of money can they expect?
So, like, if you're just doing government setup and you're, I mean, in that you're balancing your personal life as well as professional life, and you're just doing government setup. So definitely you will earn limited, but then yes, a decent amount will be there. And apart from that, if you want to do freelancing, you can also do this. In the morning hours, you can go and give anesthesia. In the evening hours, you can join an ICU. So in that way, if you are doing private work, also freelancing, also, so you will definitely earn an amount which is decent, and you can compare that amount with other clinical fields. And
Right.
if you want to go abroad, like I don't know whether I mean we will speak about it later or not. Then if you give FRC, the scope in other countries is very much. I mean, I would say that they don't prefer surgeons from Indian surgeons in USA or UK, but they will prefer Indian anesthetists over there. And this is a fact which many of the my fellow colleagues have told.
That's good to know, sir. Are specialists being in demand there?
Yeah. In Australia also, my when I was in UG, so my senior professor, he was in demand in Australia. He was called back So that is the and definitely in USA and UK, the preferences are such that you have to score very good marks if you want this branch. Unlike India, where the what I can say, there is no we have to throw light on various aspects of anesthesia, like by the means of such interviews. That is why the preference list is different. But then yes, in USA and UK, the anesthesia this branch goes very high when they give entrance exam.
Right, right. And so the scope otherwise in terms of lifestyle and earning, that might be a little more or over abroad.
Definitely,
According to-
definitely. But then you have to give special exams for each countries. Middle East countries, it is very lucrative. Then in USA, if you have to practice, definitely you will have to give USME. FRCA is a very good option where you can join and practice in Australia, US, UK. So FRCA is another option which many anesthetists prefer who want to go abroad. But personally speaking, I want to stay in India and I want to make people feel the essence of this branch. That is why I have decided not to go abroad.
It's good to know that doctors have a sense of beloved, a sense of love for their own country. And so,
Yeah. And by the means of this interview, I would like to tell all our viewers that you should also plan and stay back here so that people will know the importance of this branch if you're pursuing it.
right, sir. How do you see this branch in the next decade, coming decade? And the topic of artificial intelligence, that is quite in the limelight. So, is that in any way going to affect our branch?
Yeah, I will answer this in two parts. First, you said, how will you see the branch in next?
Okay.
Many people who were not even knowing the term anesthesia got to knew about it when COVID-19 pandemic came. And in various international level magazines, anesthetists were featured on the front page on how they, anesthetists were preferred over the MD medicine branch when it came to ICU aspect. So definitely in the upcoming years, when people will gain a good knowledge about pain relief, pain medicine, pain clinics, so the demand for anesthetists will increase. And like now also after the pandemic, when people know that yes, anesthetists are the one who can become a very good, they can become very good intensivists. So definitely the demand is increasing. Then coming to the artificial intelligence part, so there are various aspects like, for example, I will say about TCI pump, target control infusion pumps. So these things are coming in anesthesia, but then it won't affect the need for an anesthetist because, as I said, the computer they can process the part, but they every patient is different. So
Right.
how to respond, and you don't have time, so you have to respond immediately. So I don't think any machine can replace human being in that aspect. So definitely, artificial intelligence is evolving in anesthesia, but they cannot replace the humans in that branch.
Right.
Even if you see robotic surgeries, so we have to be there for giving anesthesia for such patients in robotic surgeries also.
Right. So, AI can basically harmonize with the branch, but not overtake it, definitely.
Yeah,
Right, sir?
it can make your work easy, but then yes, it cannot replace you, as far as I feel.
Right. So, what about the super specializations and fellowships available post MD?
Yeah, you can do DM. My personal wish is to pursue DM critical care. So after MD anesthesia, you can do that. That proper anesthesia branch per se, if we consider, you can go for DM cardiac anesthesia and give anesthesia for cardiac surgeries. DM neuro anesthesia is there, and then we have DM transplant anesthesia for specifically for transplant patients, especially when you are giving anesthesia to live transplant patients. Like in one OT, the kidney donor, renal transplant donor is there. In one OT, the recipient is there. So what are the special aspects? So in such way, there are various DM branches. In fact, you can also do DNP critical care after MD anesthesia, and you can practice as an intensivist. There are various fellowships and fellowships in cardiac anesthesia, fellowships in neuro anesthesia, fellowships in pain anesthesia. And after doing that particular fellowship, you can open your own pain clinic and practice there. So the scope is huge. It depends on how you want to see your life in upcoming year.
Right. Sir, you highlighted such specialties which most of us, I think, are unaware about. Yeah.
Even I was not aware about it when I practiced. Pursued my MD degree, because in internship also you don't know. Get to know about these things very much.
Right, right. Sir, what about the things to be considered while choosing a college for pursuing MD?
Yeah. See.
Any important
yeah.
considerations, sir?
Yeah. First thing, you should see the number of surgeries, the number of super specialty departments of surgery. If college is not having cardiac surgery department, CBTS, or if a college is lacking neurosurgery department, definitely you won't be able to give anesthesia to such patients, and you will lack academical. And you should also see the number of surgeries which are happening in that particular hospital, and the number of emergency surgeries which are happening, so that the more exposure you get, the more, what I can say, you can give anesthesia in a better way. And more than academics, the practical exposure is very, very, very important, apart from academics in this particular field, because you should know how patient can behave, and once you see that particular aspect, can respond in emergency situations in a very well manner. Then you should, if you are interested in critical care or pain medicine, so you should see whether, because many hospitals are not having critical care or ICU postings. Like in my hospital, ICU posting is there in Sion. In few hospitals in Mumbai also, ICU postings are not there. So if you are interested, so you should think of Sion. In Tata, there's a central institute in Mumbai. ICU postings are there, and they are very good. They teach it because it is a cancer hospital. But then the general surgery part, the ops anesthesia part is missing over there, because it is a cancer hospital. So if you are very much interested in critical care, and if you know that you will pursue critical care, DM critical care, so you should opt for such hospitals where importance is given to critical care. And if you want to practice anesthesia, so you should go for such hospitals where anesthesia is given importance over critical care or pain. You should see if you want to practice pain. So like in my hospital, pain OPD is there. So we get postings for pain also, pain clinics also. So these are the aspects which you should look before going.
Right. Guys, if needed, please again hear this answer, because sir has taken care of all the important considerations, which are very important. Okay, sir, now that you have summarized all the answers, sir, I would like to please, can you give a special message for the students, newly budding anesthetists?
Yeah, in one line, if I want to summarize, I will say that it is not about giving anesthesia or inducing patient with anesthesia. This branch is all about bringing that patient back to normal life after giving anesthesia. Because anyone can give a drug and give anesthesia to the patient, but if you are missing the patient, if you are not taking care of the patient after giving anesthesia, then you will definitely lose the patient. So everything, it is all about keeping the patient safe after giving anesthesia, which everyone says, what is the issue? Anyone can give anesthesia. That is what, anyone can give anesthesia, but to bring back that patient back to normal life is the role of our branch.
Right, sir. So, sir, you summarized how to become almost perfect anesthetist. How to be unique in our branch, and what does it take to become it, to become the best in our branch. Sir is understand that sir is revered among his patients, and he wants to stay in the country and serve the people. So I think he is an inspiration to all of us. And in case anyone has his doubts or queries, sir, can you please give email ID?
Yeah, sure. My email ID is yadav.aksh6@gmail.com. In fact, if they are having any doubt, they can message me also. I can share my number also. So my number is 967-333-4149.
Right, sir. Thank you so much for everything, and it was good to have you, sir.
Yeah, thank you for giving me this opportunity. I just wanted to highlight few important aspects. This is just a brief overview which I have given, and they will come to the branch. They will experience the uniqueness and the beauty of the branch.
Right, sir. I'm sure they would definitely do. And many of us would have been inspired to opt for this branch, sir.
Thank you so much.
Thank you, sir.